My best. This is David, physical therapist. I wanted to drop by today and talk about the nice urinary analysis that we use here. We come to your house with this device, strips, and we give a cup for you, which you usually use to take the first urine of the day. And then it allows us to detect early warning signs, problems before they become symptoms. It increases your awareness of what to ask at the doctor's office and what to be proactive about, monitors hydration and organ function, and identifies early signs of inflammation. So, what does this mean? How does it reveal to us? It reveals hydration, kidney function, liver and metabolism, inflammation, urinary tract infections, infection risk. Right over here, we see it. Nutrition balances, metabolic flexibility. All of this is so important for the person that wants to maintain their vitality, recover from anesthesia and post operation. And did you know 27% of ER visits are preventable? The top three are related to early warning signs and detection that are dehydration, which are related to falls because of dizziness, and infections. We can all track those three before they even occur in the manifestation of your body and how you feel. We can start tracking it with numbers. The fourth and last one is medical errors, medication errors in the sense of the wrong prescription was given or the person took double of the dose or something like that. Here's a picture of the 10 biomarkers that are used for the urinary analysis, which we use artificial intelligence as well as our own biological professional intelligence to consult with you. How does the results apply to you? Well, stay hydrated and with good mineralization, you're going to prevent falls. You won't get dizzy. You'll have a normal blood pressure profile. You will increase your balance profile. Hydration supports muscles and joint recovery, improves flexibility and endurance, and is just not water intake, which will help you get to the actual ounces per day that you need, but you also need mineralization to remineralize bone, tissues, and even the mitochondria exchange to create energy, ATP. Watch for urinary tract infections, early signs of confusion, and how that shows up early in the test, kidney and bladder health, and urine pH balance. Acidic, you're in danger of a lot of problems. Alkalinic or imbalanced, you are pretty good to go, and your immunity is working well. So again, I wanted to thank you, take a nice little moment to project you the value innovation that the company wants to do. We want to be consultants, physical therapists, health coaches for you to live longer in your life, at your house, stay strong, independent in your house. Let's go. Have a good day.